Is Fauci finally out? I'm Scott Ott, and this episode of Bill Whittle Now is brought to you by the members of BillWhittle.com. Bill, it's not directly an indicator that Anthony Fauci is out on the White House task force, but the president just announced this week that Dr. Scott Atlas is a former chief of neuroradiology at Stanford University Medical Center and a senior fellow at Stanford's Hoover Institution, has been added to the White House task force. Atlas is best known to, the immunology public for writing a piece in The Hill called "The Data is In, Stop the Panic and End the Isolation," where he goes through and lists 5 facts, many of which you have rehearsed for us before, indicating that there are good reasons to isolate particular groups of people, but not everybody, and that common sense guidelines for most other people will not only work, but help to establish what's become known as herd immunity and actually protect more people. Bill, obviously, this sounds like it would be good news for you. Is it good news for Fauci and for the country?
Well, it's not good news for Fauci, but it's great news for the country. And I just wish this had happened 3 months ago. But I don't know anything about the replacement, but he sure sounds like he's the guy for the job.
Well, he's not being pitched as a replacement. He's being added to the task force. It doesn't necessarily mean Fauci's being fired.
Well, this is a 3-stage event, but basically, yes. It sounds grand. He can't just openly fire Fauci at this point, but he certainly can start at the very least, and I think this is the very least we'll see, having somebody start introducing the other side of the data. And Fauci, to say that I've lost confidence in him, I mean, that'd be an interesting topic for end of April of this year, months ago. Here's my primary. Everybody talks about Fauci's political connections and all the rest of it, and all that stuff.
It's not just political connections, though, Bill. You're an outlier in this. What is it, like 70% of Americans love this guy? Let
me finish. The primary problem with Fauci is twofold. Number one, the guy who is presumably in charge of this pandemic, how the pandemic is handled, I have never heard speak anything of the good news in terms of the impact of what we've done. But much, much more importantly than that, the person who has basically been given the handling of the pandemic has at no point since March 18th, when they locked down California, has at no point given to us, governors, mayors, the president, anybody, a clear and quantitative definition of what will happen in order for this crisis to end. And I don't expect it to end in one step, but there was never, ever from the medical expert, when this happens, this can happen. And when this happens, then that can happen, and so on. And Fauci's position from the beginning has been, and I defended him for this in the early days of this thing, that his primary concern was keeping people alive, and he didn't have any political responsibilities. He's a health professional, and his job is to say, look, this is how we avoid the most deaths. But for Fauci to have that kind of responsibility, and to show essentially that I could see no consideration for the fact that his recommendations of 18 months of essential shutdown, it's that guy is the wrong guy for the job. And the reason he's the wrong guy for the job is not because you need a mathematical model to produce, here's what we can do to have the fewest deaths. Because here's the big shocker, Scott, you may not be aware of this, but if everybody stays locked in their houses forever and has food pellets delivered by the government, then that will be the best way to prevent as many people from dying as possible, which is what progressives want. They're absolute cowards in every way. They want the government to tell them when it's safe to go outside, and then they want the government to tell them when it's not. But Fauci never, ever, 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 in my watching this for the last several months, ever seemed to me to give any indication at all to the fact that as a doctor he should know that the essence, the first thing in the Hippocratic Oath that all doctors take. What is the first statement in the Hippocratic Oath? Are you familiar with it?
Well, I don't observe it, but it's first do no harm.
There you go.
So let me ask you that, because what you just said is interesting, because fact number 3 in Dr. Scott Atlas's piece for The Hill about the data related to this says vital population immunity is prevented by total isolation policies, prolonging the problem. And in fact, the approach that the White House has been taking, and most state governors have been taking, is in fact to intentionally prolong the problem, to reduce the crush of business, so to speak, at hospital emergency rooms and ICUs. And Atlas seems to be directly contradicting that, saying, really, all you're doing is making this last forever. Let the people who are very, very unlikely to die from it get it, and protect the people who it would kill.
I'm gobsmacked, because after watching this for 6 months, somebody who apparently will soon have some authority said something that makes sense. I'm just flabbergasted that somebody might say something that actually makes sense. Let's just review for the 11,000th time, okay? We were told 2 weeks to flatten the curve. What did that mean? That meant that we had to put in all of these invasive procedures which destroyed the economy and so on for 2 weeks in order to prevent what was in fact an exponential growth that was threatening to blow through the ability of the healthcare system to manage the crisis. And we did that so effectively that the hospital ships that were supposed to be taking bodies until they were chucking them overboard sailed out of New York Harbor with maybe 127 total cases. I forget what the number was. We found ourselves in situations here in California where in some places like Kern County, admittedly not a high population area, but nevertheless, they're closing clinics and sending doctors home because there aren't enough patients. Elon Musk decides that he's going to restart his Tesla line, and the reason he did so was because he put out a tweet that said, here's what the government predicts in terms of fatalities for April 10th. Here's a prediction for the 15th. Here's the prediction for the 20th. And here's the actual number of beds that are being taken place. That's data. It's not a computer model. It's not a guess. It's data. And from the beginning of this, the data has shown that to whatever degree the social distancing worked, and I suspect it worked pretty effectively, we have not only kept the number of cases below the ability of the healthcare system to manage them, we have smashed it to the degree where the healthcare system is essentially sitting there twiddling their thumbs. I live in Los Angeles. I was in the hospital 2 weeks ago just for some minor thing. I was the only person in the emergency room the entire time I was there. I was in the hospital for 2 hours. I saw one other patient. And if that's the case, and it is the case, it's not just my anecdotes, this is from all across the country.
And Dr. Atlas says that there are people who have not been able to get brain surgery. Like 80% of brain surgeries have been canceled because of their shutting down health facilities to all but these coronavirus cases. Bill, I want to read you this final little cluster of words here from Scott Atlas, because I think you'll again be shocked that somebody who's going to be advising the president would say something like this. This is his guidance. Strictly protect the known vulnerable, self-isolate the mildly sick, and open most workplaces and small businesses with some prudent large group precautions. This would allow the essential socializing to generate immunity among those with minimal risk of serious consequence, while saving lives, preventing overcrowding of hospitals, and limiting the enormous harms compounded by continued total isolation. Let's stop underemphasizing empirical evidence while instead doubling down on hypothetical models. Facts matter. Final thoughts, Bill. Slain. Ladies and gentlemen, we are grateful to the... Oh, he's back. He arose.
I'm dizzy.
Did you have a thought?
Yes. We could have saved so many businesses. We could have saved so much if we'd done that earlier, but the way to look at these things is we could have lost so much more if we'd done it later. Let me just say one thing to all of those people out there, like the hardcore progressives who say that the GOP is a death cult and that our entire purpose in life is to spread the plague. This is something I felt strongly about. I just think it needs to be said. If you genuinely think that this is as serious as you've been told that it is by experts at CNN, and you want to stay indoors until the vaccine is available, you do that. As for the rest of us, I come back to the beginning of the Hippocratic Oath. Why is it that every single doctor since Greek times who took their job seriously has had to basically swear an oath whose first words, the first words were first, comma, do no harm. And when the cure becomes worse than the disease, you're no longer a doctor. Now you're making the problem worse. Fauci clearly had never shown the slightest, in my viewing of him anyway, the slightest indication of at what point, if ever, the cure was going to do more harm than the disease. He had the faintest concern about that whatsoever. And we are well past the point now where the harm that's being done is worse than the disease. And the first thing I said about this pandemic, the first thing I said when it got out, honestly, my first comment on this was, if this is an airborne influenza-type virus, you will not be able to contain it. It's out. So instead of building a wall around everything, why don't we build a wall around the people who are susceptible to this virus? And I've said it from day one. And here's a doctor who actually seems like he might have some authority actually saying this. No wonder I got the vapors.
Ladies and gentlemen, thank you for watching once again this episode of Bill Whittle Now. It is one of some 40 shows a month we produce, thanks to the members at BillWhittle.com who actually fund this enterprise and have their own content generation machine at that website. If you'd like to find out what that's all about and become part of a band of people who want to spread these ideas around the world, like a virus, then go to BillWhittle.com and click that big green Become a Member button. This is not airborne. You actually have to touch things to make this happen. Click that button. I'm Scott Ott for Bill Whittle. Thanks for watching.